coming in on Friday, and we are doing some punch excisions today. My patient has been following us on TikTok, and she has a very severe case of what we call ice pick scars. Go ahead. And in these cases, I'm going to show you guys here. Some of these really honestly need to be surgically removed, where we literally punch them out, because you see how deep these are, okay? And we literally surgically remove them. I'll show you guys here, okay? Go ahead and hold there. And we do this because if you were to do the TCA cross, which you guys see here, take a look at the white frosting there. Go ahead down. All those, it would take so many treatments for the TCA to work. And so what we do instead is we take that little scar, you see it right here, and we get rid of it. And we utilize our ability to do surgery, because you guys know I was a skin cancer surgeon, and we close the scar. Now, the scar becomes more of a line. That line, because the face heals really well, can be lasered quite easily. And so in a week or two, we'll remove the stitches and then we'll laser. It'll be perfect timing because the scabs from the TCA cross will be healing. Go ahead, missing. And then you won't see the scar because it'll blend. Right now, it looks a little exaggerated because there's fluid from the numbing that's there. But these heal really well when they're done right, and if you Botox. So what we're gonna do today is Botox our forehead, turn it a little bit this way, but take a look at the jagged nature of these scars. Some of them are very haphazard, and so this little 2 millimeters is nothing to be able to just surgically remove, and then she doesn't have to worry about it anymore. And you guys see here, look, we literally just bam. Now, YouTube's been commenting a lot, so make sure that you're looking to see if people are writing anything. And again, you guys know, like sometimes the wrinkles, like on the forehead, for example, are vertical, like more towards the center, and on the upper portions, there's sometimes more horizontal. So here, we're a little more towards the top or middle of the forehead. We'll close this vertically. Excuse me. And then that follows what's called the Langer's line, or the forehead lines. Okay. And that makes it so you don't really scar. It makes it heal much easier. We get a little scratchy when I talk. Are they saying anything?
Yeah, how many
Something
times
to
a
drink?
year do you hold a
Pairs of water to room
Say
4,
it again?
pairs to room 4.
Sorry, you guys.
Anyone?
You go ahead.
Milton Moore wants to know how many times a year do you have preceptorship? I have been wanting to learn from you for a few years now.
Well, we used to have trainings every 3 or 4 months, you guys. And we announced it. So I don't know if you didn't see it. In the future, we're not planning any trainings yet because we're going to be purchasing practices and teaching those doctors. Yeah, I need something to drink. Hold on. So if you guys are wanting to, thank you. I'm good. If you guys are wanting to, you contact us, DM.
Where are you right now, Dr. Emer?
So we're in LA doing treatment for ice pick scars. So show them again the up close of these ice pick scars because they've really bothered her. So tell everybody, why do these ice pick scars bother you? Sorry.
Because I'm not a shy person, but because of the confidence, when people will look at me, when I talk to them, it kind of creates me to be a shy person.
Oh, that's not good because you feel like everyone's looking at them.
Yeah, very self-conscious.
I see. So that's why we got to do treatment. She's a young mom. She wants to have nicer skin.
4 months postpartum.
4 months, and she deserves to have pretty skin. So I agree. So our plan, I think, is perfect for her. And I actually love that she was willing to do this because some people get really nervous, but she was like, let's do it. Right when I said that's what we needed to do. So she was really on board. Had you ever seen this, heard of this treatment or no?
No, I seen some of the, what is it called? The box?
The ice pick scar or like box cart?
Yeah, like the cutouts. I've seen the cutouts.
Oh, you
before.
have? Oh.
Maybe like 3 times through some videos, so not very often.
Yeah, then I know. Not a lot of people do it really, to be honest. Because a lot of times, if you don't know how to do surgery, all right, let's leave that. We'll let that heal. We'll watch how the swelling goes down, but it looks perfect. Turn this way now. So, over here, you guys can see where all the TCA went. But look at some of these, like very deep. So, like for example, this one here is very deep. And so, surgically removing this is actually really good, going to be really good for her because you can see how thick, like look at this white here is scar tissue. Normally it's yellow because it's fat, but that's literally scar tissue right there. So she definitely had bad acne. So tell them, how bad was the acne?
Um, Super bad. Abnormal, I would think, because every time, you know, you shouldn't be touching your acne, but people do, and every time I would touch it and it would come out, it would come out as these hard, like
Oh my
almost
gosh.
balls, and
Like cysts.
yeah, and I thought they were supposed to be like pussy. They're not. They're hard.
Ooh.
And I noticed that is what was creating scars, was those hard like
Yeah.
acne.
Yeah,
So that was
sometimes.
my acne, was those hard things.
Well, sometimes people get actually calcification in their acne, and that might have been partially what you had, and that can be a lot more scarring. So that might be what left you with a lot more of these scars. And what we try to do is take out just a small amount of the scar because when the scar comes back together and we laser, it'll remodel and her skin will look better. So you see we're removing these. In the old days, people used to sometimes leave these left open to heal. So for example, they would actually just leave this for like 3 to 6 weeks and then it would heal on its own. It would close. And the other people used to do this where they would lift the piece that's removed and then attach it to the skin at a different place. So it's almost like a skin graft. It was called punch elevation. And what I don't think anyone does it anymore. And I find with the good lasers that we have, this allows us to get so much more of an improvement. So she was pre-numbing here for about 15 minutes because we don't want her to bleed. There's medicine in there that helps the bleeding. You see? That's all scar tissue, all that. Look, you see? You can open your eyes if you can look. I don't know if you can. Did you see that? White? It's all scar tissue. It's crazy. So, it's good. That's why acne in some people, their scars are sometimes really difficult to improve with even with laser because you have to go really deep to get past the scar tissue. Catherine?
Dr. Emer, who should Milton Moore DM in hopes of a preceptorship?
Do right on our comments. Comment there, name, email, and phone. That's what we always do. You can also always write in our website too. Okay, so I'm going to show you guys in a second when we complete this side what it will be. And again, we identified the ones that really bothered her the most, and that's where we would start, because when she comes back, she'll have a little line there, and that little line will be much easier for the laser to improve. So that's the goal. And when we do this, you want to make sure that you make it as fine as possible. Which is why we do these very little tiny ones, all right? Now, you can't always do all of them the first time, which is why some of them have the TC across. And you have to just be careful not to do them too close to each other, because otherwise they won't heal perfectly. So we're doing these little ones. I need a new needle. That needle's done. I'll show you guys. Dab. Okay. Perfect. So see, we're doing like a little. There we go. Hold on. There you go. We're literally pulling out the scar. So I'm glad that she was able to show you guys this, because we don't usually do that. So what I think we should do is we're going to finish up, and then at the end I'm going to have her do a little testimonial live so you guys can actually see all of them when the swelling goes down, because they're going to look a lot better even when the swelling goes down. That's too far. Hold on. And then you'll see how flat they are and what we'll be able to laser in about 1 to 2 weeks. Thanks, guys.
Okay.
Yeah, so now we add it to the list of her on her name, and then you have to figure out how to optimize that, but punch excision should be somewhere in the comments. So we have to use AI to generate content, name,